Welcome. In this video, we'll discuss the hypoglossal nerve stimulator for sleep apnea and how it may possibly benefit your son or daughter with Down syndrome. Obstructive sleep apnea is a condition in which breathing stops involuntarily for brief periods of time during sleep. The flow of air stops because airway space in the area of the throat is too narrow or has a blockage. While this condition is not very common in typical younger people, it is quite common for individuals with Down syndrome. The reason to treat the sleep apnea is that individuals with significant sleep apnea can be exhausted during the day, and therefore have issues focusing at school and at home, can have significant mood swings, and can have long-standing stress placed on their heart and lungs, which is not good for them. Most of the time, the first line in treatment for people with Down syndrome who have significant sleep apnea is to remove their tonsils and adenoids. If removing the tonsils and adenoids does not work, then your doctor often will try a mask to wear at night called a CPAP or BiPAP mask to help allow your child to breathe and therefore sleep better. Unfortunately, young ones just don't like wearing these masks. Enter the hypoglossal nerve stimulator. The hypoglossal nerve stimulator, or HNS for short, is an implanted device that generates electrical impulses to stimulate the movement of the tongue forward and out of the way, which is timed to the individual's breathing. There are two configurations for the Inspire device. The first configuration consists of a stimulation lead, a neurostimulator which acts like a pacemaker, and a sensing lead. There is a newer configuration which consists of a stimulator lead and a neurostimulator, where the sensor is built into the neurostimulator itself and the sensing lead is no longer needed. Please speak with your ENT surgeon regarding which device might be better suited for your child. A small handheld remote is required to turn the device on before the user falls asleep and off when the user wakes. The sensor lead is placed along the chest and senses when a breath is triggered by the change in pressure and movement of the chest wall. The information gets sent directly to the neurostimulator, which then delivers mild stimulation to the nerve that controls the tongue. The stimulation is strong enough to move the tongue, but mild enough as to where it will not wake your son or daughter up. There are several qualifications one must meet for the implantation of an HNS that includes age, BMI, and several procedures as well as several sleep studies, which you can learn about here in this video. To implant an HNS, the patient must undergo surgery, which takes a few hours. A pocket is created in the anterior chest wall for the neurostimulator and the sensing lead, if the sensing lead is necessary depending upon the type of device being inserted. The stimulation electrode requires a second incision just beneath the jawline. The stimulation electrode is attached directly to specific branches of the tongue nerve to have the tongue move forward to open the airway. After surgery, the patient usually spends the night in the hospital to help monitor their breathing after anesthesia and to be able to quickly address any post-operative discomfort. A normal diet may continue as tolerated after surgery. Any pain from the surgery can be managed at home with a combined anti-inflammatory, anti-pain medical regimen. It's so important to talk to your doctor and let them know if there is any post-operative pain so the medications can be adjusted. The two surgical incisions are further evaluated for proper healing at the first post-operative appointment. Post-operative visits are scheduled and activation of the HNS begins 1 month after the installation. In this time, you and your young one will learn how to turn the device on and off with a remote control, which works like this. The remote has 4 buttons and a status light. The green button turns the remote on, and the status light will flash green to indicate the remote is on. The gray button turns the remote off. The plus button increases the strength of the electronic impulse. The minus lowers it. The back of the remote has a light up scale to indicate the strength of the electronic impulses. Your doctor will decide where these should be set. Once the remote is on, hold the remote over the HNS in the chest. The remote should beep twice and the status light will pulse green to indicate that the unit has turned on. If the remote beeps 3 times, that means it did not connect to the unit. Simply push the green button on and try it again. Once on, your HNS should start working within 30 minutes to give the individual time to fall asleep. To turn the HNS off, push the gray off button. The status light should flash white. 2 beeps indicates the remote has connected, 3 means it has not. Once connected, hold the remote to the chest. You should hear 2 beeps and the status light should turn white. The HNS is now off. Occasionally, your child may wake up in the night. In this instance, you can pause the therapy. Simply press the green button, hold the unit to the chest, and wait for the 2 beeps. The lights on the back will pulse to indicate the therapy has paused. it will pause for 15 minutes and restart on its own. The remote takes 2 AA batteries and will let you know when to change them with the indicator light on the back. We have a 24/7 Inspire helpline if you need help changing the batteries. At some point about 10 to 15 years later, the batteries in the neurostimulator will need to be changed. Your doctor will give you information about this when you speak. In addition to the initial sleep study, there are 4 other sleep studies during the course of the first year to make sure the device is working properly, the individual is sleeping comfortably, and that the sleep apnea is resolved. So how effective is the hypoglossal nerve stimulator? Parents have praised the device over and over again, reporting full night's sleep, improved mood, improved facial muscle tone, more energy, increased cognitive performance and academics, improved speech, and overall, just a more happy young person. Please contact either Dr. Hartnick or Dr. Scottgo and their teams if you feel a hypoglossal nerve stimulator is right for your child.